The results. So in this study were involved 132 patients, and the primary endpoints was the neurocognitive function. And I have to say that the VLMT, the total learning performance score, was better in the arm with hippocampus avoidance in comparison to whole brain radiation therapy. However, this didn't reach the statistical significance. However, it's important to mention that in all the neurocognitive tests, and we perform a lot of neurocognitive tests, and all the neurocognitive tests were better in the arm with hippocampus sparing in comparison to the arm without hippocampus sparing. And what we now try to do is to pool all these results and to show if we will reach the statistical significance. However, it's no doubt that concerning the neurocognitive function, the hippocampus sparing technique is better in comparison to the traditional whole brain radiation technique. Maybe the special finding of this study was that we found that in emotional well-being, anxiety, depression, 3 months, 9 months, 18 months, and all over the time, the hippocampus sparing technique was statistically significant better in comparison to the irradiation without hippocampus sparing. And this is a very interesting information because I think this is the first study in which we evaluated this emotional part of the brain function, and was very interesting to find that the difference between these two arms was statistically significant. More than this, it was very interesting to see that we reach with this technique a very high local control. So 12 months local recurrence rate was 4% in the arm with hippocampus sparing, 12% with the arm without hippocampus sparing. So the difference was not statistically significant. The distant cerebral recurrence, so the distant intracerebral metastatic disease, was only 22%. That means quite 80% of the patients were 1 year free from recurrence in the brain. And this is the advantage of this technique in comparison to the radiosurgery alone. And the local recurrence in the region of hippocampus was 8% in the arm with hippocampus sparing and 6% in the arm without hippocampus sparing. The 12 months neurological death rate was 4% in the arm with hippocampus sparing and 12% in the arm without hippocampus sparing. This is also an interesting point. P was 0.06. So not statistically significant, but we observe a difference between these two groups. And last but not least, the toxicity was very low, with very low grade of radiation necrosis, about 15–18%. So in conclusion, I think this study showed again a constant improvement in neurocognitive function in the hippocampus avoidance whole brain radiation therapy plus simultaneous integrated boost group without reaching still the statistical significance. But however, was clear that in all the evaluations, the arm with hippocampus sparing was better, and maybe the low number of patients has an impact. This was a grade 2 study and not a grade 3. This was the first study to show that hippocampus avoidance during whole brain radiation therapy may reduce depression rates. And I have to mention, and this is very important, this was a double-blind study. This is the first double-blind study also in comparison to the North American trial. So it seems that hippocampus plays indeed a significant role in the development of depression. This is a first prospective randomized study demonstrating the feasibility of this method. This is a new treatment planning strategy. And it's also important to mention that we included also resection cavities. So we treated also patients after surgery. The treatment was safe. The high intracerebral tumor control is a fact, and also the low neurological deaths. However, the next step for our group is to perform a prospective trial, also double-blind, using all the inclusion-exclusion criteria and the design of the HIPPORAD trial. The next trial is called HIPPORAD SRS, and in this trial we will perform radiosurgery alone in patients with multiple brain metastases, and we will compare the data with the data from the presented study.